Hello everyone, I'm Judith Park, Director of Acute Services here in NHS Lanarkshire. I just wanted to take a moment of your time just to update you on the 3 site visits that we've had over the last week with the executive team. It's been an opportunity for the site teams to provide us with an update in terms of their work around Operation Flow 2, and the site visits have been hugely helpful and informative. There's no doubt that there's a huge energy, enthusiasm and commitment to the principles of Operation Flow 2, and that the team are working really hard to make sure that we get all the benefits that we can for patients and for staff. There's a lot of learning coming forward as well, and we need to be able to be sure that we share that widely and move that into the next stage, which will be Operation Flow 3. That will very much look at reform, and we've started off some of those conversations with the site teams in terms of the areas that we need to focus on. And as we move towards winter, we need to be sure that we build more resilience into the system for both our planned care and our unplanned care activities.
Hi, my name's Karen Gowdy. I'm the Chief of Nursing Services here at University Hospital Monklands. I would like to just share some information about Operation Flow. We've been working really hard as a team here at UHM to deliver on the aims of Operation Flow 2. In terms of what that's brought for nursing teams to our site in particular is the realisation that we're in a phase where we need to recover. So the teams have come through an incredibly difficult few years through the COVID pandemic, and this piece of work brings back a renewed sense of us trying to understand our systems, understand what we need in terms of workforce, but also making sure that we support our teams to deliver as we mature in this piece of work as the year unfolds. I think it's important to appreciate that the value that nursing teams bring to the operational piece of an acute hospital and their voice is incredibly important for us to understand how we develop and deliver that as we evolve.
I'm Stephen Peebles. I'm the Hospital Director here at Monklands Hospital. The next steps for us for the site in terms of Operation Flow are really to focus on changing some of the pathways and operating models that we've got on site to allow patients to move through the system in a far more efficient way, really focusing on outcomes and quality of care for our patients, but making sure that also drives an improvement in performance on the site. To do that, we're going to change where some of the wards are based, try and remove some of the steps that patients currently go through, and make the pathways that patients have on site far more efficient than they currently are. We also want to try and create an expanded elective unit on the site to try and tackle some of the backlogs that we've got from a planned care point of view as well, and these will all be critical things that we're trying to achieve before we go into winter this year.
I think the key learning from the firebreak and the first part of Operation Flow is that we can improve patient experience in the hospital, but it takes a whole system approach to do this. It's not just one part of the workforce and one part of the system, it's the whole system working together, both in the hospitals and in community.
Hello colleagues, I've been out and about on all 3 acute sites over the last few days. Today University Hospital here Myers and University Hospital Monklands, and I'm very grateful to colleagues that we met today who shared all of their ambition and fantastic plans that will help us be in a better place this winter, but also really grateful for the open, honest conversations about the challenges that also lie ahead and how we can work together collectively as a strong team to try to overcome these and ensure that everyone's voice and hopes are built into our plans. So thanks very much for the time that you've taken. Thanks to my executive colleagues who have joined me in these visits, and I really look forward to meeting with you next month when I'm out and about hearing about how you're progressing. Thanks very much.